Hi, everybody. This is the end of the conference, isn't it? Wow, this is, okay. This has been an amazing and invigorating 2.5 days for me. The goal of this activity, I should know better than to bring up an idea and say somebody oughta. Somebody oughta usually comes back to the person who's bringing the idea up. So the goal of this was to give me something that I could take back to my colleagues back at MTI and say, hey, everybody, this is what I learned when I was at CCIH. And I thought, well, if I can do that for my group, why can't we do that for everybody and create something that you could all be able to have to share with your organizations? And so we're making a bold effort to try to do something. So we asked all of the moderators to try to summarize 2 or 3 takeaway points from each of the sessions. I have 5 pages of notes now, and it's really exciting. I didn't get notes from everybody, but what I got was pretty comprehensive. I'm going to hit just a couple of highlights of things as I summarize. And first off, a few caveats. This is just a first level takeaway. This is not exhaustive. All of the comments that I've picked up on are not author approved, and they haven't been checked back with all of the people that made their contributions. Blah blah. You understand what I'm trying to say. Okay. There are a couple of recurring themes that I've seen over the years, and they came up here, but with a few twists this conference. First off, we believe that FBOs are awesome providers of direct and community-based health services and have much to say about health system strengthening, but, and we heard this again and again, in the past we've lacked proof, okay? And we just heard from our panel right now how important it is to come forward with good, strong evidence. At this conference, we started to see evidence being presented. We saw a lot of data about what happens in these health system projects, and that was really exciting. It was a nice mix of inspiration and technical information that came out. The other recurring theme that comes up at these meetings is we know that the church works at the last mile and is most attuned to the needs of the communities, so has highly effective community health worker programs. And yet there remains so much to be done in targeted areas like family planning. So we know that the church is an absolutely vital ingredient in community transformation, but there's still a lot of work to do. And we heard several testimonies and pieces of evidence around that. And one of my third big takeaways, and I'm going to summarize a couple of data points in a minute. One of my big takeaways, though, was not something that was talked about here, not talked about in the session. Are you okay, Kathy? Are you sure? Here, I'm going to hold that for a little bit. Okay. What struck me was something that was in the movie last night. I don't know how many of you got to watch the movie, but there was a quote that Ken Brantley made, which was this: faith does not save us from danger. Our faith can actually place us in danger. And frankly, it's not that we should seek that as Christians working in global health. That's not the goal. But we as the church must be ready and prepared to act, whatever the cost. And I think that was a crucial takeaway for me, and that's something that I want to take away and take back to my team. So faith didn't save us from danger. Our faith, look at that. Okay, here we go. I'm just going to cover just a couple of little things here because it's so cool that you guys had this information. In this conference, we heard some of the information about integration of faith and health, and there was some good theological discussion. One of the things that I saw interesting in the notes was there's great approaches in nursing care, education, and personal relationships that's based on a theology that basically emphasizes sacramental covenants and promoting fidelity on our part and trust on their part, the there being the people that we serve. There's something about how we approach the people in the communities that we serve that is transformational. It's not just the services that we provide, it's how we engage them. We talked at a couple of sessions about how FBOs, this was a very cool little bit, on a session talking about leprosy. And one of the takeaways that I learned from that was that it's not just about treating the conditions, it's treating everything else that goes along with the conditions. So as faith-based organizations providing holistic care, we are thinking about not just the primary problem, but all of the secondary things that go along with it and how, for instance, in a case like leprosy, how people are seen or perceived in their communities, or the assumptions or biases that people have about them. Of course, we've heard that over time about HIV and the stigma that goes with that. Faith-based organizations have a unique role to play in speaking to that. Community health workers, lots of talks about community health workers and their unique impact, and lots of data that showed outcomes, and that was really exciting. We could see improvements in everything from care-seeking behavior to antenatal care to health outcomes, and just across the board, a lot of data on that. I'm going to just wrap it up here. I'm going to wrap it up with something from today's maternal and child health section. 3 takeaway points that came from that. Religious leaders can be very effective advocates for family planning because they are respected, trusted, and committed to the welfare of their communities. And it takes time to effectively engage religious leaders with careful listening to their concerns and providing them with correct information about family planning. Religious leaders can reach all levels in their communities, from high-level political leaders that are important for supporting family planning programs to the lowest level individuals to help them in choosing the most effective methods for their needs. This is a strong role for us as faith-based organizations in this context, and a lot of encouragement for me from the presentations. Hey, 5 pages. So Kathy, we're gonna work on that and summarize that, and then if you guys approve it, then we'll share it on to the whole world. How does that sound? Okay. Thanks everybody.